Imagine trying to keep your balance while walking across a narrow, violently swaying suspension bridge in the thick of a fog. This is the reality of living with moods that swing for years, pitching up into sudden bursts of energy and confidence, then dropping into heavy, prolonged low stretches. Because there is no visible injury, the people around you might simply see you as inconsistent. When the pattern persists for years, it becomes easy to internalize that instability as a character flaw rather than a medical condition. Many people spend years white-knuckling through their daily lives, exhausting themselves to maintain a facade of normalcy, while the internal ground is constantly shifting. Over time, these cycles erode relationships, stall career progress, and damage your self-trust. These swings are dangerous because they often fall just short of a recognizable crisis. This leaves the sufferer to carry an unnamed, untreated burden entirely alone. This diagnostic gap exists in the medical office as well, where doctors frequently overlook the multi-year nature of these cycles. This chart maps the standard clinical spectrum of mood. One side shows a narrow wave of normal fluctuations. The other shows massive, erratic spikes of severe bipolar episodes. A 2-year pattern of chronic instability hides perfectly within the overlooked middle gap. Living inside this blind spot means you are fighting a phantom enemy without the right tools to stop the cycle. The medical name for the pattern hidden in that gap is cyclothymic disorder. Clinically, cyclothymia is defined as a chronic mood condition consisting of cycling highs and lows that persist for 2 or more years. As this graph shows, cyclothymia occupies a different space than bipolar 1 or 2. While those involve extreme highs or severe depressive lows, cyclothymia is a state of continuous, rapid, and moderate oscillation. Naming the condition changes the internal narrative. It shifts the burden from a personal failure to a recognized, treatable medical condition. Clinical identification provides the necessary foundation for targeted medical regulation. Treating cyclothymia requires mood-focused care, using a 2-pronged approach to study the swings. First, cognitive behavioral therapy, or CBT, provides a framework to intercept and reframe distorted thoughts before a swing takes hold. Second, interpersonal and social rhythm therapy, or IPSRT, acts as a biological stabilizer. This circular clock shows how IPSRT works. It anchors an erratic mood by enforcing steady daily rhythms for sleep, meals, and social interaction. Instead of merely surviving the turbulence, you are actively regulating your own biological system. Effective treatment builds a highly durable shock absorption system for the mind, all while preserving a person's natural emotional depth. You do not have to live at the mercy of unpredictable mood swings. Accessing these specialized therapeutic tools begins with a formal evaluation and diagnosis from a licensed clinician. Stepping into professional care is the most direct path out of the diagnostic blind spot. Coping and Healing Counseling, or CHC, provides the expertise needed to secure a proper diagnosis and begin targeted therapy. Their 100% HIPAA-compliant telehealth model serves all 159 counties in Georgia. They feature a diverse team of over 15 licensed therapists, including LCSWs, LPCs, and LMFTs, who specialize in treating depression, anxiety, and stress. This layout shows their commitment to affordability. CHC accepts Medicaid with a $0 copay, and major insurers like Aetna, Cigna, and United Healthcare for a $10 to $40 session fee. You can stop white-knuckling the swings today. Reach out at chctherapy.com or call 404-832-0102 to begin your evaluation. Understanding the way your mind cycles is the first step toward reclaiming control of your life.